What's going on, everyone? Finally.
We're back.
Yeah, we're back. They brought us back. I'm surprised they keep letting us do this,
We
Lauren.
may find new hosts next year.
I hope they may. Yeah. You know what's cool? Looking back, now that we've done this thing 3 times, it's wild how it finally caught on the 3rd time. The first year we had 300 registrants.
Mm-hmm.
Last year we had 500. This year almost 2,000.
It's awesome.
Yeah, it's
The
cool.
community is really coming together. It resonates. They're coming back, telling their friends.
Yeah. Yeah, or the country's running out of money and no
Yeah.
one can go to the in-person
It's great.
conferences. We're not sure which one it is, but hey, we're happy to have you here. This is gonna be awesome. Won't talk about any other conferences. I looked at today's agenda and I was like, holy shit, I will actually enjoy watching all of these sessions. I'm not just saying that. That's not every year. That's not every day. We have incredible stuff coming up this year, or coming up today specifically. It's gonna be awesome. We've got the CMO. Piedmont's where I had Oliver, my oldest kid.
Yeah.
And I had him the day before Cardinal started. I
Full
left.
circle.
Yeah, we kind of checked out early, dipped out, took the baby, and started cold calling for Cardinal. So he's giving a presentation today. We've got action behavior.
You made that sound like your son was giving a presentation today.
He is.
That'd
He's
be cool.
He's not. He actually interned here and thinks he hired Lauren. We had
Yeah.
Lauren pretend to be interviewing, and he hired Lauren and still
Good
thinks
hire. Good hire.
it was an okay hire. And dude, scaling up is sick, guys. We got 2 full days, and we're doing a couple things differently. Yes, we've got 50 speakers, 25 sessions per usual. We've got the Flockies.
Yeah, that's new this year. Some awards. We'll be doing those tomorrow, I think, during the lunch break. So stay tuned for that.
And we're doing a networking break, which we tried on year 1, and it kind of shit the bed.
Yeah.
So this year, hopefully it works. I think it might work.
Lunch, grab your food, pop your camera on, say hello to some friends. You'll probably run into some people you know.
I want y'all to be there. At first year, we only had 300 people sign up.
Yeah.
So there was a very small amount that could have made it. And this year we got almost 2,000. So the networking breaks, guys, use this as an opportunity. Pop in there, say hi. I know it's weird to get on a video with a bunch of other videos, and that's weird and stuff. But guys, pop in for 5 minutes, say hi, and then take it to LinkedIn after and connect with those people. And then you've got a thread going with people that you can bounce off all kinds of problems you're going to have next year. I find that super valuable.
Teams and healthcare orgs are lean. You guys, I hear that from all of you all the time. It's just me and my 2 people. And if you don't have a great agency to bounce ideas off of, who else are you able to talk to? So
Yep.
I think make some friends through this.
Yeah, and then start those LinkedIn threads. I've got multiple message chats with people in different MSOs, DSOs, and we bounce ideas. Hey, do you know this vendor? Hey, I'm interviewing this person. What do we think? How have you gotten around HIPAA compliant advertising to use this tool?
Yeah.
The system. So guys, pop into those networking things today. Action behavior centers. That's going to be
That's
sick.
just later this morning. Yep.
Yeah, I think so. We've got the CMO panel starting at 10:15 here in a few minutes, and those 3 are absolutely brilliant. And then I think at 11 o'clock, we got Dawa presenting the CMO.
Yep.
CMO Piedmont Health is going to make a panel presentation on performance branding and how it transitions to patient acquisition. And then right after, action behavior centers. And then we go in, and that one's going to be awesome. It's the largest ABA group in the country. We're going to talk about the recipe for growth and how they scaled digital advertising and all that kind of fun jazz. And then we go into the networking breaks, and then we've got all kinds of badass panels.
Yeah.
Guys, yes, there are a number of AI talk tracks this year. These next 2 days, you're going to have AI stuff. I have asked kindly that every AI panel and talk track actually comes with tactical recommendations. Tactical. What are we actually doing? This will not be your typical bullshit AI talks where we just talk about where things are going and how we think about. It ain't going to be that. It's going to be, how do we actually track? What are we doing differently?
Yep.
What are we doing differently? What are the actual results we've seen? And so I'm excited about the AI tracks. Also, several of the people, everybody on the AI panels, I personally interviewed on the podcast. I know they know their shit.
Yeah.
They were carefully curated.
Yeah, and I think outside of just that panel, every discussion we're having, whether it's incrementality or measurement or scaling media mix, how are you using AI to do that too? So I think that'll be a big theme you see woven in today.
Yeah, force multiplier definitely helps us get the job done. And then I think we round out the day with a talk on performance creative. So in the action behavior centers talk, you're going to talk a little bit about how we use creative and stuff like that to drive performance. But then Jean at 4 p.m. Eastern is going to be talking through different case studies of how we use performance creative and variations and all that stuff to improve bookings, to lower CPL, all that kind of stuff. And it's actually case study oriented. So this isn't a thing where we like put the presentations we cared least about at the end. We actually put one of the heaviest hitters at the end. So 4 o'clock, go eat your Wheaties, get your afternoon coffee later. Make sure you attend that one. It's going to be awesome.
Speak to our sponsors.
Yeah, sponsors in a second. Thank you for
Okay,
the
okay.
money. First, though, I want to say thank you to Austin and his team. This is our 3rd year in a row with our same production crew, and they've crushed it every year. I guess you guys keep coming back, so thank you to Austin and crew. Ashley, Emily, Susie, Alex, Leo, Seth, everybody that has helped with all the Vicky. The brand team
Yeah,
is
killing it.
small and extremely mighty, and they put this huge effing thing on for everybody. Raven, I see you raise your hand. I don't think you can raise your hand when there's a couple thousand people here. And so thank you to the brand team. They absolutely crushed it. The flock is excited, and thank you to the flock. They
Yeah.
cleared a lot of their calendars for 2 days to
They're going to
learn here.
present, you know, case studies and examples themselves. We've got, I think, 7 or 8 panels of just cardinal flockers presenting their expertise. So those are some of my favorites.
They are, and we always ask, give the actual tactical stuff. You don't have to name the client, but tell the country how you're actually doing the thing. That's
Yeah.
what's most important to me.
Raven said, oops, I didn't mean to raise my hand. I was just excited.
Raven's
Thanks, Raven.
excited. And guys, you know, this is fun and interactive. You're going to get the recordings, but it's more fun to be live because you can raise your hand. You can ask questions. I'll see them pop up in the CMO panel, and I'll select a couple to ask our brilliant people, and Lauren will too, and the rest of the hosts throughout the day. So feel free to enjoy it. And by the way, go into the participants. I don't know if Zoom lets you. God, I look old and shitty today. And I think in the participants, maybe you can go and try to connect with people from LinkedIn. Guys, really, I have found a ton of value. I keep saying it for a reason. Go connect with these people on LinkedIn after, so that you don't just get 2 days of learning here. You get a year's long worth of community and people that can help you through whatever the hell happens next year. Can you believe it? It's almost Halloween of 2025. I feel like we just started this year.
I know. Do we have costumes this year? We did last year.
No, we did the rocket ship thing
Yeah.
last year, and this year we're too
Oh.
serious now.
Oh,
We're
we
too
might
serious.
have to come up with something.
Ashley
else
not
for that.
letting me have fun anymore. She says, you're going to get canceled. Don't say any cancelable shit because we got so many people. All right. Katie, I
All right,
definitely don't
let's
need
hit it
more
real
coffee.
quick.
I feel like I'm on fucking hypertension stage 2 right now. Thank you for all the money sponsors. Guys, these sponsors are off the chain. Not only did they help fund the promotion of this thing, there's a reason that so many of you guys are here. And it's because these sponsors gave us money and we put into ads and email and promotion. But more
And made the
importantly,
tickets free.
and made the tickets free.
Yeah.
And I'm
Especially thank you to
we're
these
s-
guys.
We're still making a big donation to our local nonprofit on fire here. And I'm going to donate more than I did last 2 years. I donated all ticket receipts, and it was $8,000. I'm going to donate 10 grand on fire. Janae, if you're watching, FYI. So we're still going to do that. So the sponsors, guys, these aren't just logos we threw up here because they were willing to pay the sponsor fees. These are all companies we believe in and recommend on a daily basis. All companies we recommend on a daily basis.
Yeah, I mean, we would turn them away if we said this wasn't a product that would benefit our clients.
Yeah.
And the people listening, the people of this community. So
We are very selective on who
with the
we
best
attach
tools.
our brand to because we don't necessarily need the money. So we are very careful. And a lot of your discovery calls, when you talk to prospective clients, you say, hey, listen, guys, without the right measurement, the right protection frameworks, the right directory listings, the right this and that, we can't.
yeah, I
help.
mean, the data, you're going to see that as a huge theme this year. I think Alex and I are going to spend 1 minute here talking about trends real quick before we get into our CMO panel, but democratizing the data is a big theme. And it's not just, I mean, it's not table stakes anymore. You absolutely must be doing it. And so these are the tools and partners that we're typically helping to integrate at the early stages if you guys are missing key parts of your measurement framework. So.
And a number of them are putting on their own little coffee chats where I think they bring a client or the demos. Go sit through them, because if you ever reach out to an agency like Cardinal, they're going to go tell you to take a call with some of these CDPs and lead tracking and directory listings and CDPs. I just said CDPs.
It's okay.
That was the
It's
same
all right.
time. That was the second
It's all right.
TSPs. I said the
DSPs. Yep.
Anyway, so we're going to tell you to go take a call with them anyway. So go ahead and get it done here and go say hi to our friends. And thank you to our friends and sponsors. You know, a lot of them were here for year 1.
Yeah,
and it's
they've
really
stuck with us.
really meaningful. I know I didn't deliver. We didn't deliver a ton of value in year 1. So thank you for being here year 3 when we hike to the sponsored packages every effing year. All right.
All right, let's get
Lauren's
into it.
tired of me. And what? We only have 2 minutes.
I know we got to get into this real quick. A few trends, and you guys don't want to hear the trends from us. You want to hear them from our CMO panelists. So we'll get into that in just a minute. I think the biggest thing everybody knows that we've been up against this year, I refuse to say the word headwinds. Thank you, Ashley, for putting it on the slide. But just the economic climate right now, everybody has been squeezed. This concept of show the ROI. That has really intensified. Budget cuts. You guys are being asked to do more with less. And in a landscape where costs are rising on ad clicks and everything else. So we know it's been a tough year. We're going to get into it with our CMOs on how they've navigated that. I think with that comes the concept that outcomes over leads is critical. So this, we spent 2 years trying to get everybody to cost per lead. Let's track new patient leads. That's kind of table stakes at this point as well. Really focusing on what's happening to those leads. Are they converting? Are they butts and chairs? Are they driving revenue for your organization? So that's a focus for this year, and definitely going into next. Alex, anything on kind of
that's the main thing. I mean, our target demographic, and most of you are large multi-site MSOs and DSOs who are all private equity backed. Thank you, financial overlords. But it's been a tough year because the interest rates are up. They're starting to come down. I won't comment on any of that. I promise, Rob, I wouldn't. But like tuck-ins, the acquisition stuff is not really happening. And so everybody wants to drive more same store growth. That means they say, get more out of the same thing. And that's where a lot of
how do you do that
trickiness
without the right data, the right tactics, channel mix, all of that. I think,
right.
Really buying to capacity, something we've been preaching for years. I see groups that have really integrated their operational and financial data into their marketing frameworks, and that has really made a big difference. I think that's how you have a competitive edge nowadays, is really understanding your data, your organization. MOPS, 3 years ago, we Teresa coined that term, and we've been using it ever since. So I think those are some of the big things. We'll talk a lot about AI. We don't have to spend much on it today because it's going to be the theme.
The robots will talk for us.
So yeah, we'll talk about AI in a minute. I think what we want to do really quickly before we start, we're actually a minute behind, is just do a quick poll for the group.
And time is fluid today.
I know. We can make it up
time
as
is
we go.
fluid. It's virtual. We can do whatever the hell we want.
Oh, MOPS, marketing and ops alignment.
Marketing and ops alignment. And it's crazy. I've seen with clients that the main thing this year, thank you. Hey, there's a poll up. Go answer that shit, please.
While we're chatting.
Yeah, because I'll run out of things to say soon. But I've seen the tricky part that I've really seen with a lot of clients this year is getting the C-suite and the PE overlords to agree to the same number that marketing can influence and actually track and pass back to ad platforms.
Yeah, not the goalpost constantly moving and everyone's defining things a different way.
Drives me crazy because you see a lot of companies, they say all that matters is how many kept a point. Bro, y'all don't track kept a point. You don't track them from digital. There's nothing we can pass back. And unless you get the right measurement frameworks and technology from some of our sponsor friends, you can't do it.
Yeah. How are you, the marketers, you guys are the ones on the receiving end of this, being held accountable to a metric, and then you aren't enabled to track that metric, to understand how that metric rolls up to the business KPIs. It's tough.
It's wild. And every marketer we talk to knows that's what needs to happen.
Yeah.
But we can't get the CEOs. So CEOs, we can't trust them. All right. How would you describe your marketing situation, the sitch going into 26? All right. Looks like balancing aggressive growth goals with flat budgets.
Ooh, that's a fun one. Always.
What do you do with that, Lauren? What do you do?
I mean, you've got to work smarter, not harder. I think in the world of AI, we're going to be talking about enabling the capabilities and capacity of your team, not just like replacing the work, but really accelerating the pace that you can move at, and being smarter with how you use your dollars. I think that's probably the only way we're going to grow with the flat budget, because the clicks aren't cheaper. Earning your way to the top of the SERPs with the AI landscape is not easier. Nothing has gotten easier. So you've got to find ways to scale yourself and your team.
Yep. Check the thing closest to the button seat.
Yeah. Yep.
And influence that best you can. I love it. One more poll. And what was second here? Evolving the brand to stand out in a crowded market. Autocomplete.
Actually, I really love that one. I think, every day we're looking at how do we make our ad campaigns perform better. And for so many years, everyone was using the same value propositions, USPs. I really think that groups are not sitting down and carving out their niche.
Same day appointments.
Within their industry. And so we're really challenging groups to do that. I think one of the things we want to focus on working with our clients next year is what is the patient journey? Where does it start? What does the brand really stand for? And are you really leaning into that message?
Yeah.
And groups that do that well, they own and dominate. They get better click-through rates. They get better performance.
And does the patient experience it? You can share the results, Austin, if you're not already. And does the patient experience it the way marketing is saying it?
Yeah.
Does that happen when you hit call center, when you comment? Yeah. Or are we full of shit? I'm not sure.
I mean, yeah, when we were building our vision and qualities here at Cardinal, someone advising us told us, you can't make them aspirational. They are who you are at your core. You can't make them something that you inherently are not. And I think
Yeah.
that's what these organizations sometimes have to sit down and take a look in the
That's
mirror.
right. When we were doing our cardinal qualities evaluation, one of us said, well, should it be like kindness and love? And we're like, fuck no, we don't believe in any of that. Respect
Okay,
health.
we love love.
We
but-
love love. Love is blind, by the way. Megan Jordan, did you
gosh,
see that?
is
She has a
terrible.
kid with
It's a
someone
terrible
else.
season.
I think it was phenomenal. I think it was phenomenal. Oh man.
All right,
Saw
let's
last
touch on
night.
this
Can't
one real
wait for
quick
the
and then
reunion.
let's get our panelists in here.
All right, Lauren, man, this is why you got to count.
Alex is the energy and I get
Where
it
are you?
done.
I know you're my Xanax here. Where are you focusing most of your marketing energy for 26? What's winning? What's winning? 28%.
I think measurement.
Improving measurement capabilities to demonstrate. Sponsors are
Perfect
excited. Sponsors are excited about that.
Yeah.
It's all about measurement. It really
100%.
is. And it's so easy to say, I'm going to get a better lead tracking platform. It is so hard to get operations and call center to use it correctly and the
Yeah.
CFO to believe it when you show them the dashboard. Oh, it's hard. It's not easy, guys. And then do you use online scheduling, calls, leads, call center?
Chat bots, AI
Yeah.
enabled call centers. There's
Yeah.
just so many pieces.
Yeah, so many pieces. Call center wants forms, but calls convert better. Online scheduling's easy for everyone, but the providers don't want their calendars
Yeah.
accessed by everyone. Oh my God.
In all of our panels today, we're going to be asking people how they're measuring, what tools they're using. So we'll try to kind of get you guys some help there. Again, a great opportunity in the networking rooms later. If this is a challenge for you, hop in there and ask some of the other marketers what they're
Yeah.
using, what has enabled them. I think those are good chances to solve this. All right,
Ready to do this?
ready
shit?
to get into it?
Hey guys, and in the chat, help each other. The flock is in there too. 120 strong, hopefully mostly paying attention. I hope. And so they'll help you out if you need anything too. And thank you to the flock for helping put all this on. This is good. All right, panelists. Do we do the intro? They want to do the intro? What do you want to do?
Let's let them intro. I mean, who better to hear?
Meg, Brian, Jen, welcome. What to the ring? It sounds like Ringling Brothers.
Sorry to keep
Hello.
you. We're fueled up on caffeine this morning, so
You think
Well,
it'd go
am.
faster? You think it'd go faster? How are y'all?
Good.
Great.
all right. Let's get intros. Meg, will you start? Tell everybody
Yeah.
about your organization.
Absolutely. Good morning. I'm Meg Dietzel. I'm the CMO of Confluent Health. We're a musculoskeletal health company, and we have over 800 outpatient physical therapy and occupational therapy clinics throughout the country. So we're a house of brands. And then we also have occupational health and safety division, education division. So multiple things that come together to form Confluent Health.
Awesome, Brian.
Brian Venuti, Chief Marketing Officer of Medi Weight Loss. We are a private equity franchise system. We have local weight loss clinics, and happy to be here.
Fucking need it, man. This thing was too tight.
Alex had to change his shirt.
I had to change the shirt. It was popping out. I ate too much of the bagel. I got lox and cream cheese. It was delicious.
Geez, I have to follow that.
Oh, I
Love
see
that.
we've already
Alex.
got Brian. This is the Brian fan club here. Many people know you, Brian.
Jen, what's up? The infinite
there.
Jen, what's up?
Hi, everyone. I'm Jen McClain.
Oh, did we lose Jen?
Everybody loves Jen.
Oh,
We're
no.
in the damn
Lance?
car right now.
So super excited. Been in healthcare a little over 5 years. Love the space, and we're advancing quite.
Oh no, we lost Jen a little bit. Here's what we'll do. We'll jump in, and Jen, when we get you back, we'll have you do your intro again because I want everybody to hear it. We'll see if she gets.
Simon cracks me up.
Jen's internet needs some caffeine.
Come on, Texas. Come on, I was born in Texas.
San Antonio.
Irrelevant story of the day.
All right, let's
Relevant.
get into it as soon as we get Jen back when we see her moving. All right, let's start with 2026 budgets. I know we just talked about how you're being asked to do more with less. That's kind of a major theme. Is there something, and I'll start with Meg and we'll go around, that you know, whether it was, hey, let's cut this next year. I know everybody's in this season right now, so this is probably actively going on, that you would fight to the death to keep, or you already have had to fight to keep within your marketing budget, whether that's a person, a tool,
Yeah.
a capability.
Well, I would say people for sure, the team. Like I can't afford to lose any headcount. We're right in the middle of budget season. Just submitted my first pass at budget and know that, you know, we're going to look at flat or maybe a small amount of growth. So, but the company is going to continue to grow, and so we got to learn to continue to do more with less. So, in order to kind of keep flat headcount, have a fantastic team here. It has been researching tools and efficiencies and how do we continue to expand our offerings and what we are able to do with the same marketing budget.
Yeah. Hey, let me keep these people. I can get them, I can enable them to do even more next year. It's so critical to have them.
Exactly. Exactly.
Jen, I think we've got you back. So will you do your quick intro, and then I'll have you also answer the question wrapped in with your intro. When you look at your 2026 budget, anything in particular you've had to fight or are actively fighting to keep in the budget for next year?
Absolutely. First off, can you hear me?
Yes.
All right, I'm back. Technology error. So, hi everyone. I'm Jen McLean, Chief Marketing Officer of Affordable Care. We have over 400 locations for affordable dentures and implants. That's all we do is dentures and implants. Been in healthcare for a little over 5 years. DSO space. I love the space. And from a 2026 budgeting standpoint, it's really right sizing. We're PE backed, so we run a lot of analytics, but balancing brand awareness is a huge piece right now. It's a very competitive space. So brand awareness along with making sure that we have lead generation as well. So just working through the full patient experience.
Yeah, that desire of the CFO to see, dollars in machine, dollars out of machine in a linear fashion is really tough to combat. We'll talk more
Absolutely.
about that on this panel. And then Brian, I know very well that you have a very different set of stakeholders when it comes to setting the budget. So tell us a little bit about your circumstance and what you're fighting to keep or get in the budget.
Yeah, the interesting thing, I would echo headcount, but we've been a little creative in using that headcount. So we've kind of used that budget to source contract help, specialized help. And so for me, the flexibility of having it and then deploying it where we need it for the marketing department has been extremely helpful.
Yeah, more people to get more work done, but not always the scary FTE side of things.
Right.
Yeah, absolutely. Alex, you want to jump into the next question?
No, I think it makes a ton of sense. And Jen, you've got a lot going on, and you're trying to balance brand awareness and patient acquisition and try to tell the whole story. I mean, where do you start? You start with measure. Ashley said, don't fucking answer.
You always answer.
When I'm doing it, I said to stop talking. I'm gonna stop talking. How do you balance something like that, trying to get brand awareness and the patient acquisition stuff happening?
Yeah, no, it all starts with data and measurement. We have a media mix model. We're also looking at MTA and understanding kind of truly what's driving. We want to make sure that from an awareness standpoint, you've got your awareness channels, and it's not all digital. There's traditional too, but traditional helps digital. So you have to look at the full funnel and just making sense of the data at certain practices and making sure your marketing messages are right for each market. So really tailoring. Yes, we're a large organization, but tailoring it to the market differences to make sure that you're being relevant to the consumer.
That's a lot, and you're in a lot of markets, so not an easy.
We're busy. We're really busy.
Yeah. Jen's like, I don't have time for this panel, man. I gotta get back to my thing.
Yeah, thank you, Jen, for the hour.
Thank you. And a lot of house of brands out there that have lots of brands and lots of houses, and it's tough to try to build awareness, and you have to determine who's got enough market density and enough of a name to invest in brand awareness there. And how do you convince the CFO to give you enough time to show impact?
Yeah.
90 days later from the brand.
It's tough.
That's
We'll
tough.
talk about some, incrementality and some of those things in some panels later. Speaking of the competitive nature of the landscape, Brian, you guys are in a space that is heavily saturated with digital health and online direct-to-consumer players, as I know the others are too, but I know it's been tough in the weight loss industry. How have kind of your marketing objectives changed, and how is that changing what's expected of you as a CMO?
Well, I would say the table stakes of performance remains constant. I think what's changed for us is when we look at the competitive environment, we are different from a lot of the competition. And so it's the conversations with leadership have shifted a little bit broader from just pure performance to value proposition, creative and messaging. Who are we in the marketplace? And that also has to go hand in hand with our business model and our operations. And so I feel that the competitive environment has made us a bit more collaborative and sharper to really just to position us to win.
Yeah, I mean the direct to consumer like easy button is really hard to combat, and so you've got to have something really compelling. I know you all are really focused on the outcomes and how do we shout that from the rooftops. In a world where you're only in performance marketing channels, you get your 30-character headline to say that. Like, what are the other mediums, that we can say that through? So I know that's been a big objective on your side.
Yeah, and I'll just add, it brings a new appreciation for upper, middle, and lower funnel, right? When you're in the situation that we're in, we can't just survive on lower funnel. And so back to the storytelling, we have to make sure that we get it right and we infuse it at the different levels to set us up.
Yeah, absolutely.
And how do you get the right technology to be able to, how are you looking at explaining all parts of the funnel to your shareholders? How do you look at it? And I won't answer the question. How do you look at it?
For me or for everyone?
For you.
Yes, I think the big unlock is you need to combine the marketing channels with the full funnel down to the conversion, right? And so, it goes to, if leads are off or the funnel is off, you can't throw the baby with the bathwater, and you need to know where things are working and where things are not, or you could make some changes with some unexpected consequences. So for us, we've been very fortunate to be able to lock in all of our marketing in partnership with you to follow those leads all the way down to the transaction. And it's super helpful.
Yeah.
Yeah.
Knowing that the combination of the channels you're running is leading to the outcome that matters and not just the activities that directionally, look like they're going well, and then you find out the business isn't actually moving in the right direction.
I hate the vanity metrics. I hate them.
Agree. Vanity out. Throw the vanity out with the bathwater, not the baby.
Yeah, leave the baby in the bathwater. I leave them in there as long as possible because it's a fucking 15-minute break every night. Meg, so I know in PT they deal a lot with, like, there's unlimited demand and everyone comes from referral anyways from their PCP or whatever. So Meg, why do you need D2C advertising budge? How do you deal with that? Is that something you encounter?
Yeah, absolutely. I mean, it's a great question, and I would align with what Brian has said. It's tracking the right metrics and having a good understanding of where our patients come from and being comfortable with multi-attribution. So trying to push back on saying this is just a referral patient. Oftentimes they have come through our digital channels with a referral. So our digital channels still need to be there. I think I shared with you before, we're focused on this recruitment marketing and talent marketing side, right? Because even though we're bringing our patients in the door, and we have good referral flow, we need to make sure we have enough therapists out there to see all of our patients. So really building our recruitment marketing to the sophistication that we have our patient marketing and workflow and funnel in place.
And I love that. Both report up to you. Recruitment, the talent, the TA stuff. I love that.
Supply demand.
Yeah, supply and demand. And then no one can complain that the therapists weren't there or whatever. Hey, listen, I was responsible for driving, bro. What's the number one thing you find marketing can help with most in TA?
So, I mean, we're a house of brands. So we're in this mix of, we have 50 plus brands, and then, but we are working to build this Confluent Health employer brand. Folks that are coming out of PT school, sometimes they want to travel, sometimes they want to move. And so being able to help them understand the connective tissue that is Confluent Health against all these house of brands. We spend a lot of time and energy helping them understand you're going to work with this local brand. That's where your boss is going to be. That's where your culture is going to come from. But you are part of this bigger organization. And so if you're moving across the country, you can still stay with Confluent Health and be part of this great organization that's really moving the needle in the space. And telling that story. We historically haven't done that. And that's been a big part of our strategy.
So a big storytelling initiative and making sure anybody applying knows that they can move anywhere in the country and still be a part of Confluent Health. I mean, that's
the same challenge big organizations have with retaining patients, especially in multi-specialty groups. It's like, you're not speaking to each other internally. And it sounds very much like that's been a big success unlock for you guys with the TA side of things.
Absolutely. Yeah.
Lauren says the smart things that I never get to correctly. I love that. All right, back to patient acquisition. Jen, I know a big part of the gig right now for you is changing the narrative from leads to butts and seats. What's going on there? How are you retraining the org?
Yeah, so we're kind of looking at two things. One, we've been very kind of price promo, right? When the economy is tough, right? So trying to get people in, but instead of looking at cost per lead, yes, we optimize by cost per lead all day long, but really kind of retraining the organization that marketing has to drive appointments, right? We have to drive, as we call it, butts and seats. And it's a partnership with operations. So it's kind of, throughout the patient experience and throughout the journey, it's like two steps further, right? Because at the end of the day, we want to go get more people from a retargeting standpoint, just like the people that actually showed, they booked an appointment, they showed up, right? And they converted. So going to that analytics from a CPA standpoint is what we're focused on, and just retraining kind of the whole team of how to look at it from a full funnel approach and making sure that we're going after the right people. And it also it's efficiency of spend as well.
Yeah. And I saw a comment pop up, which is kind of perfect on this topic. And then I'll ask Brian about it. Disagreeing with that the vanity metrics should be thrown out. And, all jokes aside, they are great leading indicators of what is to come. And so they're part of the equation of measuring success. If we see this all the time in some of our campaigns, if you move your optimization signal to something really, really far downstream, you can kind of choke the system. And all of a sudden you're focused on a very small volume of high quality things and you miss, then you really throttle volume. And so I think that they have to work together, but focusing on the leads alone sometimes doesn't always translate to the business outcome. So it's a really tricky dynamic to have to.
Yeah, absolutely. And just to add to that, recently we saw an opportunity since we switched our metric of optimizing off of acquisition, so cost per start, working with our PE firm to go find incremental funds for the back half of the year. So again, it wasn't just a lead, it was a true start. And PE, financial people, CFOs, they all understand that because we all want starts. So that's an easy win if you get it right to get additional funds.
Yeah. And Brian, I know, you've battled getting the phone to ring with people actually butts and seats as well. And your stakeholders are both individuals up at the board level, but also all of your franchisee stakeholders who are running their businesses day to day. How are you battling kind of framing those metrics and helping people understand why, yes, leads and phone calls are important, but there's also this other thing that we have to make sure we're focused on?
Yeah, I'll start by saying I said I hate the vanity metrics, but I
can't
still
walk back anything said here. What stays is scaling is fine. No walking back. We stand by what we say, Brian.
all right, then I'm still a hater of the vanity metrics, but I'm not going to kick them out. Leads are important, and there does come a point of diminishing returns that even if your quality improves, if you don't have enough leads, you're not winning, right? So I will qualify that. I just, from a vantage point of, do you want a ton of leads, right, that don't convert versus more qualified? And it's always a struggle, right? Because when I started, we had a lot of not qualified leads, and the push was, give us better leads. In doing that, they were more expensive, and sometimes you get less. And now we want more, right? And it's my job to kind of work with our agencies and work with you guys to find that good balance. The other thing that I share is that our cost per lead has gone up. And so there comes an element where we don't have full control of all of these pieces. And so with the cost per lead going up, my best option is to improve the quality and improve the down funnel metrics. And so that's where we're very focused. I was thinking it's very similar to in the B2B world, the MQL, so marketing qualified leads versus an SQL, a sales qualified lead. I mean, it's a very common thought process. It all has to work together, but hopefully that helps a bit.
Yeah, absolutely. And I think one of the things too, I'd love to get to, you guys are all talking about this, and we talk about, let's get really tactical, advice for the people listening in. Has anybody, in this measurement, whether it's upper funnel, mid funnel, bottom, how it all works together, found kind of an unlock via a tool or a measurement framework, whether it's MMM or incrementality, anything that y'all would say, hey, we pivoted to measuring or looking at the data this way, and it's really helped?
I can give a quick.
Go ahead, Brian.
Yeah, I was going to say I can give a quick insight we had. I think historically we have treated paid social or tried to force paid social as a lower funnel channel, just because it is done by some of our competitors, and that's a hard thing to do. And we are now adjusting to put paid social more in the middle upper funnel. It doesn't mean it can't have dual benefit, and it doesn't mean we're not tracking it and wanting it to pay for itself. But that's been a different perspective that I think is going to help us more short term and long term.
Yeah, absolutely.
I'll piggyback off that. We're doing the same, Brian, putting social upper and mid, but then also using a media mix model to make sure that we're looking where there's oversaturation by a channel, by market, where there's undersaturation, just to make sure that we're getting the budgets in the right channels.
Yep.
Jen, real quick on something you said earlier, you got to retrain the org and everything like that. Where did you start? Is that starting at the top? Is it starting with more stakeholders than that? Your own team? Like, help other marketers understand when they come into your situation where it's a turnaround. There's more turnarounds coming in 2026. Where'd you start?
Yeah, I believe it definitely has to start at the top. So, working with the CEO, working with the whole C-suite, making sure they understand the metrics, and also making sure you have a strong partnership with operations, right? Because our job is to drive those new patients and they have to convert them. But if we don't have a partnership, we don't have a lockstep, we don't understand the same KPIs, then there's going to be a disconnect. So I strongly recommend operational partnership there. But then also working with my team to make sure that we were looking at the funnel the right way, because I'm new here to Affordable Care, but just making sure that we're all on the same page, and then working with the private equity firm to make sure there's alignment there as well.
Not easy, not easy. And then,
No.
and then the plan better have worked. At the end, you got like
It always works, right? Yeah.
Jen's plans always work. I can't.
I wish I could say that.
So, and that goes back
Test
to
and learn, test and learn, my friend.
And I think a big part of the thing CMOs are probably looking at is making sure that things actually
Yeah, what
convert,
happens
because
to the leads?
we're
It's frustrating
correct.
when you
And-
drive leads and
if the cost per start's not going the right way, it's like, you mofos in the call center, then you don't know how to sell. Meg, you've got 60 brands and 800 clinics, and every one of those brands and regions thinks they need more money. How do you balance giving Peter and Paul the right amount of love and money?
Yeah, I mean, it's constant assessment, data, right? So where do we actually need more patients coming in the door? And we put some on them. So we actually don't do much paid social, but we really look at social as brand building in these local markets. And so, I mean, we put some things on them to really create some of their own content. It's not just us feeding them content, but when it comes to converting and getting patients, putting dollars to drive patients in the door, we manage that. And I think Jen is spot on. The partnership with operations is so key. Understanding what they're working on from scheduling capabilities and workflow, and making sure we're matching that. So if we are anticipating that we're going to have a lot of openings coming up in the next quarter, making sure we're adjusting our spend to match that.
That's smart.
yeah,
Buying on capacity, basically.
yeah. And I mean, but I think the firefighting mentality, when you have so many locations, so many stakeholders, can really sometimes make you feel like you're doing only that and not living at the strategic level, or you're reactive. I'm sure, Meg, in your organization, you feel that. I think setting the plan and trying to get the org to see that plan through, you've obviously put it in front of them with a high level of confidence and a way that you want to measure it. Any advice you would give to other marketers who feel like they can't get out of that firefighting mode?
Yeah, I mean, it may sound harsh, but you own your calendar, even if you don't think you do, you do. So make time to work on this strategy. You just have to. We did a session with my team earlier this year. It was kind of like a Shark Tank. We called it pitch or ditch, but everybody had to do research on, there's so many tools coming out. What do we actually need in our organization? So everybody took time and did the research. And so that takes some hours away from the day-to-day grind, but we got to set ourselves up for success in the future. I can't be the one that's actually investigating hundreds of marketing tools and determining what we need. And so now when we move forward to budget time, we've kind of got our top 5 or 6 that rose to the top, and we've put them in the budget. So make the time, because that's your real value. That's why you're in these roles. It's making sure you're keeping your eyes up on what's happening in the next 2 to 3 years.
Yeah. Brian, I know firefighting is part of the role. How are you balancing that? How are you keeping yourself out of only firefighting?
I think there could be a perspective of be strategic on the tactical, right? Sometimes we think there's the tactical, there's the day-to-day, and then there's, this other bucket of strategy. I try to challenge myself and the team to look at the day-to-day and ask the questions, can we do it different? Can we automate it? Can we do it better, right? Because you got to solve those problems to make the capacity that Meg was just talking about. So be strategic with the tactical. That's my advice.
The problems aren't going to go away just because you ignored them, right?
I do
Exactly.
Alex disagrees.
I'm hoping the cats are going to feed themselves. Still hasn't happened. Still hasn't happened.
Jen, pivoting a little bit, you guys sit in a CMO seat, and a lot of people listening sit in similar seats or have aspirations to grow into those seats in their current orgs or otherwise. I think people want to understand what it's like to have to build trust at, up at the highest possible level. And Jen, I know you're in the middle of a turnaround and building trust at the same time. You come in with a certain amount of trust, but then you have to maintain that and grow that. What's kind of been the most, effective way to earn the credibility or keep the credibility that you obviously came in with?
Yeah, I think you have to approach it, especially in a turnaround, being very transparent, right? And have a clear strategy. Like I said, in partnership with operations, but making sure that not only leadership, but your private equity sponsors understand how long it's going to take and get their buy-in. Because obviously PE firms want to move as fast as possible, right? That's the nature of PE. But just having clear expectations and working with the team as well. So we've kind of taken a step just to gain trust of the last 4 months, really focusing on, okay, we want to win 2026. And every day, it's like getting in your own silos. It's like check the box, right? That's so easy to do. But every day we take an hour out and look at, okay, what is the true end-to-end patient experience? Let's put our consumer hat on, right? And make sure as we're transforming all the moving pieces of the patient experience, we keep the customer in mind. So that's been something that has been really helpful, not only for marketing, but I think the whole organization as we're kind of pioneering this thought process to make sure that we're in lockstep with all of our marketing messaging.
Does call center report up to you, Jen?
Call center is currently in operations, but we have a partnership there. So we're talking daily through Teams.
Yeah. Okay. Yeah. And you talk daily. And what, to help educate everybody, what are the main KPIs you're looking at? What matters most to evaluate effectiveness? What do you?
Yeah. So, obviously in the marketing world, we're looking at cost per lead, cost per acquisition, CAC, but we're really focused right now as we focus on our marketing message. And as Brian mentioned, trying to drive as many qualified leads as possible. Our big thing that from a marketing to call center handoff is our schedule rate. So we're seeing our schedule rate grow up because we're driving more qualified leads. So that's the partnership there. And then through the patient experience process, the next handoff is in clinic, right? From a welcome call, show up rate. So that's where we're having owners. So it's not just a marketing problem, it's a cross-functional to make sure that we understand all the KPIs and who's accountable for them.
And Brian, you own call center and have been a big part of putting a call center in. How has that transition been for the organization? How have you seen that affect the metrics, but also just the patient experience?
Yeah, it's one of those things where the live call, the inbound call is the warmest lead, right? If you can answer that call. And so we started from a place of just saying, where's their low-hanging fruit? And we had a lot of clinics that were not able, for good reasons, to answer those calls. And so, building it, we have some great partners, and I'm not going to diminish the efforts, but really the key there is, can we maintain the quality and the patient experience on the phone? And we are continuously working on it. We just had our convention and shared it with our franchisees, and there is a ton of interest. So I think it's just a great add-on to make sure that we're capturing the demand and the paid money is well spent.
And Brian, you guys experimenting with AI in kind of the call center side of things?
We are. I'm a firm believer that AI has already doing some amazing things, particularly for service businesses and businesses that require schedule, right? So chatbots have always, for a long time been connected to the EMR or scheduling system. But now they're at a place where they can be smart about when and how to reach out. They can answer common questions. They could be on brand, and they could facilitate an appointment or transfer it as needed. And so it's an amazing complement to our standard CRM patient journey and the live channels.
Yeah, I think it's, you talk about the burnout and retaining great talent and all of these things and enabling them by taking some of the harder, busy tasks off their plate and allowing them to, like you said, if an AI bot can get the basics out of the way and transfer to a person to really explain the product, and that saves them time and allows those people more time spent with the patient, really getting them to convert. So I think,
Yeah.
Meg, are y'all doing anything with AI kind of in the inbound call side of things?
Did you say, I couldn't hear if you said,
Yeah,
did you say
Meg.
Meg? Yeah.
Yeah.
Yeah, I would say we're exploring that. I don't know that where Brian is. Where we've really seen AI make a difference in our organization is within clinical documentation. And that has really, I wouldn't say we have a great patient experience, but it allows our clinicians to actually focus on the conversation with the patient versus focusing on the documentation, decrease after hours time of documentation. So there's been a lot of energy there to try to roll that out as quick as possible across our organization.
Yeah. And when you think about, a process like that, you've got this balance of putting some standardized practices in place and then kind of the autonomy. Where do you find, especially when you're like working within the complex org and reporting up and building trust, that, process empowers you instead of kind of the bureaucracy of, the day-to-day? Have you found certain processes that have helped you build trust like within the org and allow you to focus on the strategic?
Yeah, I would say, I mean, I came from a large publicly traded company and we're also private equity that's gone through fast growth. And so process often comes kind of on the back end of that. So, I mean, it came with just building some basic processes so people knew who to call and what to do when they needed something. And that makes people feel good, like they know what to do. We always, I want to check our team that we're at risk of over processing. So using our project management tool to the nth degree instead of picking up the phone and having a conversation. So I think it's helped build trust, but I want to make sure that we continuously assess that we're not over processing things and we're still humans working with humans. I mean, we're in a patient care business and, we don't see our patients, through a project management tool. We are human beings having human interaction. So it's important that we maintain that.
Yeah, the process can sometimes take the critical thinking out of it. Hey, this is a little bit different. I want to do this better. I want to change this. I need to break process to make this better. I think that can be the downside for sure.
I saw a random stat, and last week that healthcare has adopted AI faster than any other industry in America.
Was that self-reported by the healthcare industry or?
No, it wasn't. It was definitely real. It came from the government. No, and I think that's cool. There's almost an unlimited demand for healthcare. And so I think it's really cool. And I was, we were doing trick or treating. I was with a cardiologist, why we did it so early on Saturday. I was with a cardiologist and he showed me PHI, whatever. The name wasn't in there, but he showed me someone's heart and the valves. And he said, I couldn't find where there was blockages, but I uploaded it into a tool and it said it did find different things. And so it's cool. AI is really helping healthcare. And in marketing, I saw Rachel Russell mention they're using AI scheduling for after hours stuff. I thought that was cool. I'm loving this chat. I think it's so cool that people are helping each other and responding. And I can tell they're not all from the flock like the last 2 years. We were like, please put comment on things. So this is cool.
Yeah.
This is cool. I just think it's
Everyone's
awesome, guys. Yeah, 3 years in, it's finally a real big thing. I don't know. I'm not taking it for granted. All right, keep asking a question.
No, we've got a few minutes left. So I want to make sure we kind of get one more good question in for everybody. And then, we've got a couple look ahead things we can end on. Let's see here. What do we want to ask from this? Well, we talked a little bit about AI. I think, Brian, we talked about AI in the call center. And I think Aaron, I saw come up in the chat and said, Brian's the AI king of Medi weight loss. Anywhere else that you have found or you think marketing at your organization will be fundamentally different next year because you're finding ways to integrate AI?
Yes, I mean, in the creative process, I think most companies are using the basics of AI in terms of, adjustments in scenes. Where it gets a little controversial, particularly in a healthcare company, is representing patients with, full AI, right? And so we're trying to set some standards for ourselves of, not misrepresenting our patients, but still using AI to speak and to talk and I think one thing that your team actually shared in a recent call, which I agree with, is the ability to mix AI with real content is starting to get a little traction and humanizing it versus an all or nothing. And so I do think companies are going to figure out their right balance on how they use AI. And yeah, I'm looking forward to solving it for us.
Yeah, I mean, taking a real patient story, it's rooted in what they went through, who they are, what their outcomes were, but perhaps they're not willing to share that in a non-written format, but you need something more engaging to tell that story. I think experimenting with, AI voiceover, AI, personas to tell the story on their behalf. I'd be curious, Meg or Jen, are you guys experimenting with kind of telling patient stories using AI yet? And I know it's a big area in healthcare that could swing too far, is not regulated yet. And so organizations all have different ideas on what their risk spectrum is with that.
Yeah, I'd say we're all in on the AI front as we have to move fast from a transformation standpoint, but then also we're doing a brand refresh that we're launching in January. So getting those testimonials, getting those stories and making sure, I would caution AI is amazing, right? But still in the early front, making sure, especially where we are going through this transformation and kind of this brand piece, we cannot lose our brand voice. And that's so easy to do with all the different tools out there. So making it's the same in search and social across the board. And all of our partners have a different AI tool, but making sure that we still own that at the end of the day, because we always have to take a step back and brand comes first, and making sure that we have that true patient experience so that we're not confusing the patient, because relationships matter, especially in our business from a patient standpoint. And then if you have a great patient relationship and you have great marketing, great patient experience, that's that 1 + 1 = 3, and making sure that drives word of mouth from a brand standpoint.
Yeah, it's kind of that garbage in, garbage out. Like you've got to have the right inputs, and then you really have to make sure what's coming out of that has the human oversight that it really speaks to the brand. I've seen some groups do some really cool things with building almost like a brand voice agent that can help you to check that by uploading some of like your best pieces that you think really represent your brand and continuing to feed that too. So it's almost like human plus AI helping AI with human oversight can really get the machine moving. Meg, what about you? Are you guys doing anything on the creative front with AI?
Yeah, I was just going to add, I think I would say we're kind of dual pathed. I mean, on one side, authenticity is so important, and I think will continue to even be more important as there's so much more AI and people are wondering what's real and what's not real. And we're telling the story of pain, and folks have a lot of options when they're in pain to get a solution, and we want them to understand the benefit of physical therapy. So we are definitely authentically filming and doing patient stories. We just launched a mini documentary. That being said, we are using AI for editing, definitely for imagery. With so many brands, we don't want to have the same image across all 50 brands. So we are using it for static imagery and for editing capabilities, and continuing to explore other ways we can use it.
I think AI is interesting. You have to be so crazy. I think that's why
You got to be a little risky.
Yeah, you gotta be, because AI will never say the crazy shit that I would say. So I love standing out. I love that AI's around. I can't wait to be AI next year. We don't have to do this. We're
Just AI Alex.
Yeah, just AI out. Good luck, AI. Jen, you're building a team. What's the core
Functions.
function?
I was just going to help you get to the word.
What's the core functions you would want in-house? Your first two people other than you. What is core to building a team in-house? What do you insource? What do you outsource?
Yeah, I would say definitely a strong head of data analytics. It's great to make sure to pull all the business metrics and the media metrics to make sure that we have the story right. I'm a big believer in data funnels, the channels to make sure the right decision. So that's one. And then having a very strong lead on the performance media side to make sure that we're allocating the dollars right, understanding the data. So it's the data analytics, but then also kind of the execution channel person.
I love that.
Yeah.
Because usually I hear head of
Brand,
somebody understands brand.
social,
Would
yeah.
brand be third?
Brand is definitely, I'm a big brand person. I make sure my entire team thinks brand. It's not just the brand marketing manager. That's across the board. So we're all thinking brand first as well. So it doesn't matter what channel you own, what skill you have, your brand first.
Live in the brand.
You live
Yeah.
it. And Doug, you need to.
Live in the brand. I like that. Yes. We all live in the brand.
All right,
Yeah.
I love that. That helps. Anybody have a different take on who your first couple hires would be? And I love the data thing because that's
I think we haven't heard that
we
one
get
as much
tripped
in the
up.
past. I think a lot of groups felt like, oh, it lived with finance, it lived in other places, right? And I was just here to drive leads. And I think that has been a big shift. Using partners to own your data is really challenging. We find that all the time. I think
Yeah.
you've got to have someone owning the stitching of it together, really understanding the business outcome with and we could feed, you can feed the marketing stuff into it, but that is not itself a standalone answer.
And affordable's big, but if you're a little smaller, your marketing director can own it, but take some other things off her plate so that she can focus on getting the right data into the agency to measure the right
Or as
things.
Brian mentioned, I mean, even a great contractor, if it's something that you feel like you just need part-time support on to get it off the ground as well.
I think we're at 11. We're about at
Yeah, I mean, I
11.
would love to hear, let's end it at this, and we've got 1 minute left. When you guys think about 2026, in one sentence, major shifts you think from 25 to 26, if you have one. Meg, I'll have you go first.
Sure. Yeah, I mentioned it before. I mean, it is really focusing on our employer brand and building the sophistication marketing to physical therapists out there, just as we do with patients.
Yeah, Brian?
I would say ensuring that we are making progress on proactive and reactive, because things are changing so fast. And so we need to win today, but we need to absolutely start doing things for tomorrow and not play catch up.
Yeah. So much easier said than done, but I love the focus on it. You got to focus, you got to start somewhere. Jen?
Yeah, mine is similar to Brian. Currently, we're at the current pace of the company, and to win, the marketing team has to be like 6 months out. My goal is to get 3 months out here real soon. So our goal is to make sure that we're in front of the entire company on how we're going to drive and change the company from a projection standpoint on leads and starts.
Awesome. I think we did a little Q&A throughout. We don't have time for an official Q&A. We could, talk to you guys forever. It was so great to have you all here. Meg, Jen, Brian, thank you guys so much for joining, kicking off this event. A lot of what you said, it will be nuggets throughout the rest of our sessions. We've got breakout sessions on just about everything you guys covered. So it was really great to start at a very high level with what's going on in the landscape. Alex, you want to intro we have a session that's starting right now. So everybody who's on the line, please hang on, and we'll see our CMO panelists later. You want to do a quick intro?
It was awesome. This CMO panel always starts us off. Yeah, it's badass. Thank you guys, hundreds of people answering each other's Q's and A's and stuff. And it was so cool. Jen, Brian, Meg, we owe you one. Thank you so much for starting this thing off. Real nice, real insight. It got me thinking. Now I'm in my own head. Okay, how do we standardize measurement? AI, what's the right level? And how do we get call center kicking some ass? Thank you, guys. We appreciate y'all so much.
Good to see y'all.
Thank
And
you.
hit them up on LinkedIn. These are 3 of the best and most gracious
We're
marketers.
like, Alex, we're busy. We don't have time for that. No, I'm just
I
kidding.
just need
That's
30
what it's all
minutes.
about.
Please. If we don't have superstars, no one will come. So go hit them up on LinkedIn. They're very gracious, very caring marketers, and they will help answer your stuff. And you guys got lots of clappies and lots of hearts. So you must have done good. Must have done good. All right. See y'all.
All right, guys. See you later.
Thank you.
See ya.